Hello, I'm Dr. Mustafa Kıraç. I have been a urologist for 16 years. I am working in Ankara. I have been accepting patients in my own clinic for 2 years. I am married with children. Holep is the operation of removing prostate by peeling it completely from the outer capsule of the prostate with a holmium razor. It is the surgical method used for benign prostate enlargements. The Holep method is used for patients with benign prostatic enlargement who do not receive medical treatment and who have decided to undergo surgery. The prostate volume should be above a certain size so that we can easily remove the prostate with Holep. Holep management can be applied to any patient who needs surgery and has a benign prostatic enlargement. Holep surgery is performed under general anesthesia or local anesthesia, introducing to below the waist, under operating room conditions. With the laser we use, the prostate is visualized by entering the urinary canal of the patient and is completely peeled from its outer capsule. Thanks to the laser, this peeling takes place very easily. Then the prostate is thrown into the bladder in its entirety. It is disintegrated in the bladder and taken out with special devices called morcellators, and the surgery is completed. After Holep surgery, the patient is usually discharged a day later. The most important advantage of Holep surgery is that it can be applied to every patient. Prostate surgery can be performed with Holep today without the need for open surgery for the group of patients who had open surgery in the past. The most important advantages are less bleeding, shorter operation time, shorter hospital stay, and shorter recovery time. Holmium laser is used for the treatment of Holep. The same lasers can be used in similar treatments. For example, a thulmium laser and an NDEC laser is also used. The most important advantage of the holmium laser over these lasers is that it is safe. In other words, it inflicts less damage to the tissue. The tissue depth is less and the wavelength is different from the others. Therefore, the holmium laser is the most effective laser and is more reliable than other lasers. After endoscopic laser treatments such as Holep and Thulep, the patient is usually discharged from the hospital a day later. After 18 to 24 hours, the patient is discharged from the hospital. After the patient's treatment with Holep is completed, the patient goes home with a probe. On average, the probe remains in the patient for 3 to 4 days. Then, they stop by our clinic and remove the probe. 1 week after the catheter is removed, we do the necessary checkups. Patients undergoing Holep surgery should be subject to the same follow-ups as patients who have prostate cancer. Therefore, these patients should have prostate checkups once a year, even if they have undergone surgery. The phase after Holep surgery is very important. If the right timings are not done, some problems may occur. Therefore, it is necessary to comply with the physician who manages the treatment. At the same time, carrying out the probe extraction process at the appropriate time and keeping the patient from doing difficult tasks. You should not consume red fluids. Stay away from hot and sour spices. Pay attention to showering and bathing, and follow the doctor's recommendations. I wish everyone a happy, peaceful, and healthy day. Stay healthy.